Thank you, Venki. I appreciate the introduction. I'm going to talk about the patch trial that was completed about 4 or 5 months ago with the PerQseal, a large bore closure device. Here are my disclosures. You can see I'm really committed to a lot of different trials, as you see from the past and current, related to closure devices. But the topic is PerQseal. It's a 14 to 24 French large bore closure device. It is available in Europe, and it has undergone multiple studies in Europe. And finally, this study patch trial was carried on in the United States and has been completed. It consists of a bioabsorbable patch, so the closure from the inside, not from the outside, which is different than some of the other closure devices, such as Manta, for instance. And it's bioabsorbable within 180 days. Now, there were two last trials in Europe done, Frontier 4 and Frontier 5, and the success rate was very high. As you can see, only one major and 10 minor complications. So the study design was similar like to many other large bore closure devices, which is mandated by FDA. And it's a prospective multi-center single-arm study. Bill Gray and Sean Layden were principal investigators. There was independent screening committee, CEC and DSMB. So the follow-up points were evaluation at 30 minutes if any problems occurred, at 1 hour, pre-discharge, 30 days after, and then 6 months after the procedure. And of course, the study was designed to look at the safety, major exercise vascular complications with this device, and effectiveness, time to hemostasis. There were some other additional endpoints like minor complications, technical success, and time to device hemostasis. So here is a flow of patients. As you see, a significant number of patients were excluded. Out of 256 that were consented, only 128 were available with intention to treat at discharge. So it was a pretty strict criteria, which was standard: morbid obesity, severe calcification, small vessels, and so on. And when you look at the patient characteristics, predominantly the patients were male. Those is marked in red. Distance from the skin to the access site was 4.8, which is pretty standard. And as you see, the great majority of patients underwent TAVR procedures. Some of them underwent EVAR, and we personally did one TEVAR procedure. And so in most of the cases, a large bore, there were two devices, small bore and large bore used. The great majority required a large bore device, and the sheet size varied from 12 to 24, an average was 20. Now, as far as performance goal outcomes are concerned, using VARC2 and FDA criteria, as you see, VARC2 was relatively low. That was a 30-day major complication of 0.8%, and by FDA criteria, 2.4, which is low as well. And as far as performance goal, looking at the time to hemostasis, the average mean time to hemostasis was 3.7 minutes. So when we look at 120 patients with intention to treat at the time of discharge, at the 30-day of follow-up, you can see the major vascular complications and minor vascular complications were relatively low. And time to hemostasis, as I mentioned, varies, but 82% of patients had access site closure without any bleeding. So that's a pretty, I would say, impressive number, even though patients were not necessarily reversed as far as heparin is concerned. And when we look at p-values for those things, mean time to ITT was great, as you can see, and time to hemostasis was also high as far as p-value is concerned. So in conclusion, patch pivotal trial, it's a single-arm study. It was prospective and multi-center study that was adjudicated with this particular device, with bioabsorbable PerQseal device for large bore closure, showed a very low rate of vascular complications, major and minor, and rapid time to hemostasis. And the data was submitted to the FDA, so I'm sure they will receive an answer fairly soon as far as their assessment of the results are concerned. Thank you very much for your attention.